Hello, and welcome to the fourth part of the Sleep in You series, part of the Four Wing Balanced Library. This series is presented by the Four Wing Health Promotion Department. This session of the series will be talking about the relationship between alcohol and sleep. First, let's understand what alcohol is exactly. Alcohol is a depressant. This means that when consumed, parts of your brain are slowed, which affects your thinking, behavior, breathing, and heart rate. Alcohol is produced by fermenting or distilling various fruits, vegetables, or grains. Fermented beverages include beer and wine, which could have an alcohol content between 0 to 5%, 15%, and distilled beverages include spirits such as rum, whiskey, or vodka, and have a higher alcohol content. Canada's lowest drinking guidelines are a form of harm reduction. Keep in mind that alcohol consumption has inherent risk, so although these guidelines can help you lower your risk of related health and other issues, they are not risk-free. The guidelines were developed to help healthy adults of legal drinking age who choose to consume alcohol make informed decisions about the amounts of alcohol they do consume. In Canada, a standard drink equals 13.6 grams of alcohol. A standard beer is 341 milliliters or 12 ounces with 5% alcohol content. A cider or cooler is the same as a beer with 341 milliliters or 12 ounces and a 5% alcohol content. When we're looking at wine, a standard glass of wine equals 142 milliliters or 5 ounces with a 12% alcohol content. And distilled alcohol such as rye, gin, rum, vodka, or other spirits is a standard drink when it's 43 milliliters or 1.5 ounces with a 40% alcohol content. It's important to remember that alcohol content does vary across drinks and brands, so sometimes the standard drink quantity may be lower or higher even if the volume of the beverage stays the same. Homemade wine and beer can range in alcohol content. When it comes to beer, alcohol content changes whether it's a radler, a light beer, or a strong beer. So these are some examples. When it comes to a 473 milliliter can of radler at 2.5% alcohol content, this would equal 0.69 standard drinks. Same amount of alcohol, same amount of beer, so a 473 milliliter can, when it's light, so a 4% alcohol content, equals 1.11 standard drinks. And if it's a 473 milliliter can of strong beer, which is 7.1% alcohol content, this equals 1.97 standard drinks. Wine can also vary in alcohol content. So a 5-ounce glass of 14% alcohol content wine equals 1.21 standard drinks. And if you were to consume port or sherry, which is at 20% alcohol content and it's a 5-ounce glass, you're looking at about 1.73 standard drinks. The guidelines also stipulate different recommendations for consumption for women and men. Women can consume 0 to 2 standard drinks per day and no more than 10 standard drinks per week. Men can consume 0 to 3 standard drinks per day and no more than 15 standard drinks per week. Special occasions only happen occasionally, such as one's birthday or a holiday. During these times, women can consume up to 3 standard drinks and men can consume up to 4 standard drinks. It's important to always have some non-drinking days planned every week to minimize tolerance and habit formation. Remember that 0 is the limit when pregnant or planning to become pregnant, when driving a vehicle or operating machinery or tools, including lawn machinery or tools, or at work, doing any kind of dangerous physical activity, and responsible for the safety of others. Older Canadians, so those above the age of 65, should never exceed the recommendations. As people get older, their bodies process alcohol more slowly, so they may become more sensitive to the effects of alcohol. So now let's talk about alcohol and sleep. Research has shown that alcohol does, generally, help people fall asleep more quickly, regardless of the amount of alcohol they've consumed. The sedative effect of alcohol lasts throughout the first part of the night, where a person may wake up less frequently and for shorter periods of time. This is true regardless of sex or age. Regular drinkers tend to develop a tolerance to the sedative effect of alcohol. Research has shown that after 3 to 7 consecutive days of drinking, people no longer feel the sedative effects of alcohol. Research has also shown that if someone were to consume a small amount of alcohol just before bedtime, they may experience a delay in falling asleep, as the alcohol acts as a stimulant rather than a sedative when blood alcohol content is rising. Regardless of sex, age, or the amount of alcohol consumed, research has shown that alcohol increases the amount of non-REM sleep during the first part of the night. The greatest increase is found in those who have consumed a considerable amount of alcohol. Polysomnographs have shown that people who consume 4 alcoholic drinks before going to bed experience 1 to 11% more non-REM sleep than after they don't consume alcohol. People who drink small or moderate amounts have an increase in non-REM sleep of between 0.5 to 7.5%. Effects on non-REM sleep disappear rapidly as tolerance increases. Consuming alcohol prior to bedtime has been shown to increase slow-wave sleep patterns, also called delta activity. These waves occur during N3 sleep or deep sleep, meaning that the amount of deep sleep is going to be increased. Alpha activity is also turned on at the same time, which is not normal during sleep. Alpha waves typically occur during wakefulness or periods of relaxation. When both delta and alpha activity occur together, restorative sleep may be inhibited. When alcohol is consumed, REM sleep is replaced by non-REM sleep. Research has shown that if a person drinks lightly or moderately, there will be no change in the amount of REM sleep they experience during the first part of the night. If a person were to drink heavily, they would experience a significant reduction in REM sleep. When examining the entire night, moderate and heavy drinking reduces the total percentage of REM sleep that is experienced. Since alcohol promotes sleepiness and disrupts sleep cycles, it prevents REM sleep from alternating normally with non-REM sleep. Since REM sleep is considered the most restorative type of sleep, an individual who gets less than optimal amounts will wake up feeling groggy and unfocused. So what about alcohol and the circadian rhythm? So circadian rhythms are the 24-hour rhythms that are governed by a master biological clock. These rhythms regulate almost all of our body's processes, including our metabolism, sleep, sexual drive, cognitive functions, and the endocrine system. When we consume alcohol, our production of adenosine is increased. Adenosine is a sleep-inducing chemical in the brain. This is what helps you fall asleep quicker when you consume alcohol. However, as you sleep, levels of this chemical decrease quickly, meaning that you are more likely to wake up before you're actually rested. This experience will, overall, disrupt your circadian rhythm. Because circadian rhythms influence all of our bodily functions, disruptions to these rhythms can affect not only our sleep, but other systems as well, including poor liver function. Research has found that alcohol consumption exacerbates certain sleep disorders. Examples include insomnia, which can be affected by moderate to heavy alcohol consumption through the increase in wakening occurrences, reduction in the amount of REM sleep, and changes in sleep stages. Sleep apnea is when breathing is paused as a result of the upper airway becoming blocked during sleep. Alcohol causes the throat muscles to relax abnormally, potentially leading to a blocked airway. Alcohol may also reduce the brain's ability to detect a lack of oxygen in the airway, leading to longer apneas as the brain may experience a delay in sending an emergency signal to start breathing again. People are also more likely to snore when they've been drinking due to the relaxed throat muscles. Although snoring itself isn't dangerous, it is associated with a higher risk of hypertension. Alcohol can also increase incidences of sleepwalking. The pineal gland, located in the middle of the brain, secretes hormones in accordance with the circadian rhythm. This process is prominent while we sleep. Hormones include melatonin as well as the growth hormone. During non-REM sleep, the growth hormone reaches peak secretion. When alcohol is consumed, hormonal secretions decrease, including that of the growth hormone. So here are some tips for alcohol and sleep. Remember that when consuming alcohol, moderation is important, so keep with the Canada's lowest drinking guidelines. If choosing to consume alcohol, do so earlier in the evening rather than just before bed. This is the end of the session on alcohol and sleep. To learn more about sleep, check out the rest of our 7-part sleep series.